Well, let's go back to our top story now. The acting health minister says that the third wave in Gauteng could be worse than the first and second ones. So is Gauteng prepared for the high volume of cases, the number of people walking into vaccine sites and mass testing drives? Well, I'm joined now by our senior reporter, Aviwe Mtila, who's on the ground visiting hospitals. Aviwe, good morning to you again. What's the situation there on the ground? Are we seeing hospitals filling up?
Well, there are concerns, eNCA, and measures in place. Essentially, we heard of the visiting hours that have been stopped here because of the surging numbers of COVID-19 infections in Gauteng. We've heard some of the measures even in the ministerial briefing that we heard just now. But I just want to catch up with DENOSA's provincial secretary in terms of getting the insight from the health workers' side. There are medics from the SENDF that have been announced by the minister. How will this help your medics even?
Thank you so much. I think that will assist a lot because recently, as soon as like yesterday, we've received a number of complaints and challenges from a number of institutions within the province, whereby a lot more employees are getting infected. Now that means you've got contacts of those employees. Now you've got an influx, a higher number of patients to see with a lesser number of nurses available to assist those patients. And spacing has also been a problem in terms of order availability and so forth. So we are hoping that the availability of the SANDF will go a long way in assisting in keeping the pandemic.
Okay, I just want to get your thoughts on the announcement of the 300,000 vaccines that have been earmarked for teachers that have recently arrived.
That is going to help a lot because if you look at it, in recent times we've had a surge in terms of infections at schools and amongst teachers and children in particular. So if we have teachers being vaccinated, it will assist a lot in making sure that those frontline workers are also protected and safe. And it will go a long way in making sure that our children are kept safe as well during this time.
Okay, I want to get an idea of your frontline workers, the healthcare workers. Are they all vaccinated?
Not at all. In Gauteng, we're still struggling. As slow as the vaccination of the elderly is, we're still having the same problem of healthcare workers who are still not yet vaccinated. And it's a concern because now we are already in the midst of the third wave, and yet we still have people who are supposed to be working as frontline workers against COVID who are not yet vaccinated, not by choice, but because the system is not conducive to the whole process of for them to be able to do that.
And what are your members telling you how it's like during this third wave?
They are very frustrated and they are scared because, as you've heard, there's shortage of oxygen in some of the hospitals. And as I'm saying as well, the influx of patients where you have one ward which is supposed to be catering for about 32 patients, but the ward having 50 patients at a time. And you've got situations where you've got the other hospitals have had to open more COVID wards because they do not have enough beds. That means then that there's supposed to be some form of scaling down on other services within the department.
Okay, thank you very much. Bongani Mazibuko, Provincial Secretary of DENOSA, painting a scary picture there of wards that are full to capacity, in fact, overfilled. eNCA, as we heard, those that were supposed to have around 30 patients are now having 50 patients, while not all the healthcare workers in the front line have been vaccinated.
Yeah, I mean, Aviwe, that's really worrying. Here in the Western Cape, apparently most have been, and those who haven't have been anti the vaccine. To hear that there are frontline workers who haven't been vaccinated at the start of the third wave, or however far we're into it, is of extreme concern. Thank you so much for that interview and for crossing to us.